In our province and across Canada and around the world, but particularly in the United States and parts of Europe, the number of novel coronavirus infections and deaths continues to rise. Today's global number of reported infections is approaching 900,000, and the number of deaths attributed to the virus is roughly 45,000. The Canadian totals are 8,600 identified infections and just over 100 deaths. Here in Alberta, testing has confirmed 117 new cases over the last 24 hours, bringing the total to 871. This large jump in the number of new infections in Alberta is due mainly to the fact that Alberta Health Services processed a large number of backlog tests, indeed over 4,500 over the past 24 hours, a record number for a single day. That backlog had developed because of a temporary shortage of reagents, an essential element in the testing. We now have an adequate stock of those supplies. We also must share the sad news that 2 more Albertans have died as a result of COVID-19. Our deepest sympathies go out to the loved ones of those who have been lost. This has been the toughest week of the pandemic for our province, with the number of deaths increasing by 8 to a total of 11. We need to be upfront with Albertans. The hard truth is that things will get worse before they get better. That said, Alberta's pandemic response is strong. We continue to lead all provinces in per capita testing, and indeed we continue to lead most of the world. And we have one of the highest testing rates, as I say, in the developed world. Alberta Health Services expects to take delivery within days of new COVID rapid testing kits that will expand our capacity by thousands of tests per day. The more we test, the better informed we'll be about where the numbers are headed, and the better we can plan for the healthcare response. It's important to note that so far, only about 2% of those tested for COVID-19 have been confirmed as positive in Alberta. And bear in mind that that is testing a very small group of people who show symptoms or who are in high-risk groups.
So I think when Albertans see the number of 871, they should be concerned. I am concerned. I think the reason we focused on the backlog piece is that from day to day, in terms of what we report of new cases, we're only able to report what's been tested, but that's not a reflection of the number of people who get ill every day. So again, what we're seeing is numbers that have been compressed. And so the point that I'm trying to make with respect to the backlog comment is that we did see a couple of days earlier this week where we had quite low numbers. Today obviously is a very high number, but the overall percentage of the tests that we're getting that are testing positive is relatively constant. And so I think Albertans should be concerned. Again, I am concerned, and that's not because of the number that's specifically today. It's because we are seeing again about that 2% positive rate in our tests over the last several days. And what I am wanting to do, I'm working with my surveillance and epidemiology team to look at the last several days of data that we've received, because we did just change our testing protocols earlier this week. And so by the end of this week, my plan is to be able to tell Albertans, what does this data mean? How should we be reacting with respect to, are there particular locations or groups that we think are more at risk? And does this change in terms of our focus on particular areas?
We actually have a 3 to 4 month supply of most of the items of personal protective equipment that will be required by our frontline healthcare workers. The supply is slightly less for the N95 respirators that are used under specific circumstances. Of course, we are in the process of sourcing additional supplies should they be needed. We do have sufficient supplies on hand currently, with plans to bring in additional supplies as needed. We need to communicate this, and in fact, we're just sorting out exactly how we're going to do this. We want to communicate with our frontline staff that we do have the supplies to keep them protected, and we will keep them protected.